Hello, everybody. My name is Aman Chauhan. I'm a medical oncologist and neuroendocrine tumor specialist at University of Miami. I lead our neuroendocrine cancer program at Sylvester Comprehensive Cancer Center and also co-lead our theranostics drug development program. Today, we would be talking about a very important and a unique study called NETTER P. P stands for pediatrics here. As you all know, neuroendocrine cancers or neuroendocrine tumors are rare diseases. But you might not know that neuroendocrine cancers also afflict our pediatric patients. Unfortunately, the treatment options for pediatric neuroendocrine tumors, especially the metastatic patients, is nil. So we are constantly looking for developing clinical trials to help our pediatric metastatic patient population to help us treat this disease better. Now, PRRT, and to be precise, LUtathera is now FDA approved for metastatic progressive neuroendocrine tumors of GI origin and pancreas, the midgut NETs in the US. And it was NETTER-1 clinical trial that helped us achieve that, because NETTER-1 clinical trial showed that LUtathera really helped stabilize the disease as compared to the control arm. Building on that success, it is very intuitive that the drug should potentially also work in neuroendocrine tumors afflicting the pediatric patients. And NETTER-P study is going to help us answer some of the critical questions. One, is it safe to give PRRT in pediatric patients? And two, how effective the PRRT would be in pediatric NET patients. So I would like to thank LACNETS for giving me this opportunity to throw some light on this important study called NETTER-P. This particular study is going to evaluate gastroenteropancreatic neuroendocrine tumors. So these are tumors originating from midgut, small bowel, pancreas, as well as also paragangliomas, especially if the patients have somatostatin receptor positivity based on the gallium-68 dotatate PET scan. It's an international study, and we are collaborating with centers throughout the US as well as Europe. And the study is sponsored by AAA and Novartis. The key objectives of the study is to, one, look for the safety of this drug, because in the past, there has been no prospective multi-center study looking at the safety of LUtathera in pediatric patient population. We are also looking at dosimetry of LUtathera in pediatric patients. What does that mean? Is we want to study how much radiation is going to organs in pediatric patients and also in the tumor. Some of the other key secondary endpoints are looking at the effectiveness of LUtathera, and then there are some exploratory correlatives or endpoints. These are scientific endpoints which helps us understand the disease better, the drug better in this subset of patient population. What are the key inclusion criteria? Who are the patients that can benefit from this important study? So the study is looking for well-differentiated grade 1 and 2 neuroendocrine tumors which are originating from GI tract, especially midgut NETs and pancreas. There's also a small exploratory cohort of paraganglioma. So the patients with paraganglioma who express somatostatin receptor will also qualify for this study. Patients should not have resectable or early stage disease. So the only patients who are being considered are patients with metastatic disease or unresectable disease. What are the key exclusion criteria? Patient having any organ function dysfunctions, you got to have normal blood counts, liver function, kidney functions, any other secondary malignancies coexisting at time of participating in a trial, and as of course established or suspected pregnancy, because it's a radioactive drug and can be teratogenic. With that, I would like to conclude my presentation. I think it's very important for us to help pediatric neuroendocrine tumor patients, because they really don't have any on-label treatment options for metastatic progressive disease. This is a bold and a brave study looking at establishing new treatment options for pediatric patient population. I really commend the study group and the sponsors for thinking about this rare but important patient population. And the study is currently enrolling. So if patients who are interested in participating, please check out ClinicalTrials.Gov for all the active sites currently enrolling patients on this study called NETTER. Thank you so much for the opportunity again to throw some light about this study. Thank you.